I think I heard the first two words, that it was positive. And then I think it was kind of a blur after that.
That was 1.5 years ago, but news of the diagnosis seems like just yesterday for 50-year-old Pia Robinson of Weirton.
Telling my family was really difficult.
Pia found a lump in her breast while in the shower and at first received a misdiagnosis from a doctor in Pennsylvania. But she trusted her gut and got a second opinion.
They actually looked and they saw that the lump was quite a bit more than what I was told at my previous appointments.
Because Pia was proactive, she caught it early.
I did have radiation after my surgery, and I did 5.5 weeks of radiation, and it just, it's been just a whirlwind since then. I mean, I'm doing great now and, feeling really good, and it's 1 year later, and it's just amazing.
Now she wears her pink proudly and shares her journey with others fighting the same battle. She's also grateful to her doctors at Weirton Medical Center, like breast surgeon Carol Slomsky. Dr. Slomsky says women typically avoid coming in for 2 reasons. The first is fear.
The treatment that we have now is so much better and more easily tolerated than what we had in the past.
And the second reason, fear of the financial burden. But Dr. Slomsky says there are programs to help women receive the care they need, and finances should never be a barrier. As for the current guidelines on when and how often to get mammograms, doctors say that's changing, in part because of the number of false positive readings and the anxiety and stress that can bring.
Take into account her other risk factors, like having it in her family, being overweight, sedentary, never having had children. Putting all of that together and certainly discussing that with her primary care physician and coming up with a plan that's right for her.
As Weirton Medical Center undergoes construction on its new 5,000 square foot breast care center, doctors say there's work you can do on yourself.
Just like we know that smoking is associated with lung cancer, obesity and lack of exercise are associated with breast cancer. So if you can take a brisk walk, 30 minutes a day, 3 or 4 times a week, you'll be doing a lot to lower your own risk.
Another easy thing to do at home.
Even if it's just looking at yourself in the mirror after you come out of the shower, to be sure that you're not seeing anything, any reddened spots, any dimples, any lumps.
Slomsky finds that women generally know when something is wrong with their bodies. The key is acting on it, as Pia did.
My family, my friends, I get emotional, but they were amazing. The love, the crying, the emotion. You have to soak it all in, but you have to appreciate every day. And I think it's essential that, you just keep that faith there, stay positive, and just keep smiling, because that's what I do. Yep.
Wonderful.